Physical versus mental. MS patients' beliefs on their disease causes. Nature.com reports on a story where folks in a Swiss MS registry gave text data on their theories about the etiology or causes of MS. Now, we all very well know that multiple sclerosis affects the brain and the spinal cord, and it makes it hard for some people to move, see clearly, or feel things at the way that they used to, like on their feet or their hands and such. But you also very well know that MS isn't just about physical symptoms. People who have MS often think about what might have caused their disease in the first place. I mean, then these type of thoughts are really, really important because they affect how people feel emotionally and how they stick to their treatments. The Swiss study wanted to understand what the people with MS might have believed caused their disease. So they asked 486 people to share their thoughts and crunched that data and found some commonalities. Now, the group talked about 19 different things that they thought could have been the cause of their MS, with the most common issue being stress from life or work, mental health issues, or like, if someone in the family also has MS, or what diet they ate. So they grouped those commonalities of those answers into 4 main categories: physical health, like diet and exercise; mental health, like stress and emotions; scientific risk factors, like things scientists know increase your risk for MS, like viruses or lack of sunlight; and chance, just random bad luck, bro. Now, the responses, it's for me, it's like, the common responses at 56% were about the physical stuff, like what were you eating and were you exercising or whatever. The second set of answers that people got in a close second, 54% were about mental health. Now, a chunk of these folks actually after this really feel that, things that scientists say would cause MS. Now, also, there's a little bit of people, 13%, 3%, which actually means 14 people. 14 people. There's a 486 people study just thought that, this is just bad luck. I got MS, That's just, there ain't nothing else. Not my diet, not my exercise. Just, I got bad luck. 13, 14 people. That's a lot of people. Anyway, all of this shows how important it is for doctors and nurses to talk about mental health when treating people with multiple sclerosis, because more than half of the people living with multiple sclerosis believe that stress and mental health play a big role in causing that disease. Look, 56, 54, 56%, that's a lot of percent, people, okay? Like, they just need to make sure that people are also doing well emotionally too. Now, another important thing is that everybody has their own ideas about what caused their MS. And those ideas affect how people take care of themselves. Like, for example, if people think that, the stress caused my MS, then they focus more on stress relief than other treatments. I mean, personally, I feel that, stress relief is big on my list. Like, I meditate 2-3 times a day because of that and because of that reason. And like, that's kind of why this channel is called No Stress MS. So I'm in the bigger percentage of them all. And the point of this whole thing is that it is important for doctors to talk with their patients about what the patients believe and to explain to the patients what the scientists know about MS. So it's like, you're sitting here with your doctor. The doctor needs to ask you what you believe is the cause of your MS, and like if you have any role in on that, or do you think it's just bad luck? Because no matter what you think, it's going to, whatever you think is going to affect how you go with your treatment plan and, how on board or how not on board you're going to be with things. And when doctors and patients have these sorts of conversations, it can make people make better decisions about their treatment. And bottom line, This just is, I'm going to say it's important again because people have different ideas about why they have MS. And that really, really matters because if the doctors are listening to these beliefs and also sharing accurate information about MS, the doctors can help people with MS feel better emotionally about the MS and make better choices about their health. And this way that, they could live the best life that they possibly can. Like the more the doctors and the patients see each other and like see eye to eye, the more one is going to be able to figure out their best way forward when you get an MS diagnosis. Because it's messy, man, and not people forget, like one forgets that you're dealing with people. Yeah, you're dealing with sick people, but you're dealing with people. And so talking to the people and seeing really what makes them tick and see what they're going through emotionally is really going to be the thing to help people figure out the best way forward with their MS. Because legit, more than half of the people who have MS owe their emotions and stress and what's going on in their lives is a big factor in how the body developed MS. So you gotta pay attention to these things. And last but not least, exciting news! I am going to be chairing a discussion about something like this at the ECTRIMS conference this year in Denmark with Professor Bart van Weiermeersch, Dr. Helen Ford, and MS creator Roxy Murray. Now, if you know anything about MS, you know that these three folk are just some of the best, dopest folk. So if you just, I don't know, happen to be in Copenhagen in another few weeks and you're going to the ECTRIMS conference, holla at your boy, pull up, because I'm going to be there and hosting this conversation with professors and doctors and influencers to other MS doctors and people who are concerned with multiple sclerosis at one of the biggest conferences about multiple sclerosis in Copenhagen this year. So that's incredibly exciting. So just if you happen to be in Copenhagen, pull up, son. And I'm gonna just catch you another time.